The keto diet has been making headlines as celebrities publicly argue over it through social media.
A new documentary is stirring controversy by calling the trendy keto diet the magic pill.
What is the ketogenic diet?
Coronary artery disease.
I have asthma.
Type 2 diabetes.
She has epilepsy.
Autism.
High cholesterol.
Cancer. I'm way skinnier than last time. I'm way healthier than last time.
Keto, keto, keto.
Everybody's talking about it, one of the most searched topics on the internet, and we are right away going to dig into it. So grab your favorite drink or your favorite snack, and let's get started.
Allow me to reintroduce myself.
It's your favorite Dr. Harry.
Don't let me overdose.
The ketogenic diet has been around for years now and is gaining popularity in recent days because of its many benefits.
Coronary artery disease.
I have asthma.
Type 2 diabetes.
She has epilepsy.
Autism.
High cholesterol.
Cancer. I'm way skinnier than last time. I'm way healthier than last time.
That said, it might not be compatible with everyone. The keto diet was not originally designed for weight loss, but for treating epilepsy.
What? Wait a minute. Wait a minute. Wait, first of all, you're not going to speed past that like you didn't just say what you just said. What was this? What year was this?
In 1920, doctors realized that keeping their patients on low-carb diet forced their bodies to use fats as the first-line source of fuel instead of the usual glucose, for reasons not entirely understood even today. Fueling the body on primarily ketones reduces seizures.
It's really amazing.
However, with the development of anti-seizure medication, few people with epilepsy rely on ketone diet, but some people who don't benefit from medication can still benefit from it. The ketogenic diet is a high-fat, low-carbohydrate diet that forces the body into a state of ketosis, which is burning fats for energy instead of carbs for energy. I want you to understand that there is nothing like a zero-carb diet. Proteins can't be broken down into amino acids, and the liver uses amino acids to create glucose through biochemical reactions. We call this gluconeogenesis. Fat can also be converted to glycerol, which is taken up by the liver and converted to glucose via gluconeogenesis. Our bodies run on glucose from carbs.
What drives the body of a human being is the food, and glucose actually is purely food. So if you have very low glucose, then you can't perform. It's the only way to maintain your energy, your focus, and even to actually maintain your mental strength.
And when our bodies are out of glucose, they depend on fat as a source of fuel. A keto diet forces the body into a state called ketosis, meaning that the body cells depend largely on ketones for energy. You become a fat-burning machine that is perfect for weight loss without hunger. Keto diet can be described as a strict low-carb diet, a gluten-free diet. It's similar to paleo diet, and it's very close to Atkins diet. Celebrities adherent to this diet include Halle Berry and Kourtney Kardashian. A standard American diet is composed of 35% fats, 15% proteins, and 50% carbs. And keto is different. There are preferences one can choose from. This is standard ketogenic diet composed of a low-carb, moderate protein, and high-fat diet consisting of approximately 75% fats, 20% proteins, and 5% carbs. Cycle called ketogenic diet, which involves adhering to a standard keto diet 5 to 6 days per week, followed by 1 to 2 days of a higher carb intake. In short, the cycle called ketogenic diet involves rotating between a strict high-fat, low-carb ketogenic meal plan and a higher carb intake. The higher carb days are referred to as refeeding days, as they are meant to replenish your body's depleted glucose reserves. This kind of diet is popular among those seeking muscle growth and improved exercise performance. What is the difference between cycling ketogenic diet and carb cycling? Are these two the same? Many people normally compare the two, but I want to tell you today, the two aren't the same.
Oh, really?
Carb cycling, a person has to cut carbs on certain days of the week while increasing intake on others. Typically, each week is divided between 4 to 6 days of lower carb intake and 1 to 3 days of higher intake. While they may have the same concept, carb cycling doesn't reduce overall carb intake drastically enough to reach ketosis. Carb cycling is usually used to promote weight loss, boost athletic performance, and encourage muscle growth. Keto carnivore diet. This diet involves meat and animal products and excludes all other food sources such as fruits, vegetables, nuts, grains, and legumes. Studies show that this type of diet can promote weight loss. Protein helps you feel fuller after meals, which is associated with weight loss. It helps you also burn more calories. Targeted ketogenic diet. This type allows you to add carbs around your workouts. Simply put, it's nothing more than a regular keto diet, with the exception of eating carbs around your workouts or working out times. Meaning any day you work out, you will be consuming carbohydrates. This type is meant for people who work out regularly at high intensity or for extended period of times. So if you are sedentary or only do low intensity exercise a couple of times in a week, then stick to standard ketogenic diet. Higher protein ketogenic diet. Just like standard ketogenic diet, but with more protein, changing the menu to 60% fat, 35% protein, and 5% carbs. This is meant for those who need protein to help protect muscle mass, like bodybuilders and other old people who need to protect muscle breakdown. Also, a good option for those who show signs of protein deficiency. There is also strict keto diet used for epilepsy treatment, sometimes called a therapeutic keto diet. So if you hear someone is on a strict ketogenic diet, it's more likely to be treating epilepsy. Indicated for those who are non-responsive to epileptic medication. There is also the lazy keto diet. The purpose is to make keto easier to follow. Counting calories, fat, and protein intake for some people may be difficult. So all they do is track carbs in lazy keto. So it's meant for those who are interested in ketosis but don't want to be bothered with tracking calories, proteins, and fats. Experts say that is contraindicated for pregnant women, people with diabetes who are using insulin or taking hypoglycemic medication, or type 1 diabetes with the risk of ketoacidosis. This type is also dangerous when you follow keto and sometimes fail to follow it. Experts say that ketosis is all or nothing. You are either in ketosis or not. You risk putting on or gaining weight, and lipid levels may also increase. Studies also show that those who take a cheat day on keto could be harming their blood vessels. The Mediterranean-keto diet. Experts say that this type is like a combination of two popular approaches, sticking to a standard keto macro amounts while emphasizing Mediterranean diet elements like fatty fish and olive oil. Main emphasis is on the quality of fats you eat. Standard keto doesn't specify the quality of fats. Mediterranean keto diet emphasizes on options like monosaturated fatty acids, which may help lower LDL cholesterol. If you are a huge fan of salmon and sardines, this may be your favorite keto choice. Keto 2.0 or Keto 2.0, a lower fat type of the standard diet. The breakdown here is 50% fat, 30% protein, and 20% carbs. According to experts, this kind has been gaining traction for those who feel that the standard keto is too restrictive and difficult to sustain the long run. Amount of fats are decreased while carbs and proteins increased, with the idea that you will be able to eat a wider variety of carbs, such as from fruits, vegetables, beans, and whole grains. Leaner portions of meat and seafood are emphasized. It's intended for people who are looking to lose weight but have a harder time sticking to very low amounts in the standard keto. Experts say that there is no research that indicates it's effective for weight loss.
Are you serious? Here we go again.
With a higher carb intake, one will no longer be in ketosis. This is not a keto despite the name, but makes it close to a moderate low carb diet. Such maintenance phases in Atkins diet. Dirty keto. Experts say that is similar to standard diet but expands the menu. The difference between the two is that the source of macros can come from any kind of food, including highly processed foods and packaged meals. It doesn't really matter where the macros come from. For example, instead of getting healthy fats and low carbs from almonds, you can get your macro amounts or macros from barbecue pork. Again, experts say that this may be good for those who need a higher level of convenience and lack of time or interest for cooking and meal preps. It can also be a good route for those who are fresh into keto and also those who are traveling or have tight schedules. You can travel or do your chores while sticking to keto. Studies show that consuming too much ultra-processed foods with artificial flavors, sugars, preservatives can lead to nutritional deficiencies over time and load you up with too much sodium and unhealthy fats. And also, something that is added to food to extend the durability can shorten your lifespan. Since these foods may contain preservatives, overuse increases in overall mortality. Clean keto, as the name suggests, sounds like the opposite of a direct keto. Calls for eating organic and other healthy versions of our foods. Similar to standard keto, but the difference is clean keto is based on sourcing the healthiest versions of foods. That means you'll search for or look for terms like organic, grass-fed, pasture-raised, and cold-pressed. You will also lean heavily towards whole plant foods. That's according to experts. This approach may be for those who focus on food quality just as much as they do on macro tracking. This kind is kind of expensive since the foods tend to be more pricier, and also since you may be eating loads of plants, don't think that they don't contain carbs. Earlier I told you that there's nothing like a zero carb diet, so you will need to keep your macros in mind. So it's good for you to discuss with your doctor to see which of these diets may be suitable for you. The process of going into ketosis takes a few days. People experience some adverse effects. We call this keto flu. Symptoms may include brain fog, irritability, nausea, GI dysfunction, headache, difficulty in sleeping, and constipation. For an average person, keto flu can last a week or less, but in extreme cases, the keto flu can last up to a month. However, depending on your genetic makeup, you may never experience keto flu. Having symptoms of keto flu doesn't always mean you are in ketosis. It's just your body reprioritizing how it metabolizes food for energy. Nutritional ketosis is only achieved once your body starts producing enough ketones to become the primary source of fuel for your body. Drinking water, replacing electrolytes, avoiding high-intensity exercise, and good sleep may help relieve the symptoms. What are some of the foods that one should consider taking? Base your diet around these meals. Eggs. They are high in protein, low in carbs, and eating eggs promote a feeling of fullness. Meat and meat products. Red meat, steaks, hams, sausages, bacon, chicken, turkey, fatty fish, salmon, trout, and tuna. Meat contains vitamin B12, creatine, taurine, not found in plants. Shellfish and fish contain anti-inflammatory omega-3s that are associated with improved mental health and decreased risk for disease. Dairy products, grass-fed butter and cream, and processed cheese. High-fatty dairy contain quality proteins, vitamins and minerals, and conjugated linoleic acid, a fatty acid that promotes weight loss and helps reduce the risk of a heart attack and stroke. Mozzarella nuts and seeds like almonds, walnuts, pumpkin seeds, chia seeds, sunflower, flax seeds, groundnuts, pecans. They are rich in fiber and minerals, reduce the risk of heart disease, certain cancers, depression, and obesity. Also consider healthy oils. Olives and extra virgin olive oils contain antioxidants and anti-inflammatories. Coconut oils, high saturated fats but lower levels of cholesterol and help lose belly fat. We call this medium chain triglycerides. Medium chain triglycerides are absorbed by the liver and converted to ketones, decrease calorie consumption, increase energy levels, and improve brain function. Without forgetting avocado oil. Cruciferous vegetables such as broccoli, cauliflower, cabbage, and other cruciferous vegetables contain vitamin K and A, and also sulforaphane, which can help detoxify the body and protect cells from oxidative stress. Low-carb vegetables, tomatoes, onions, peppers, and most green veggies, healthy herb spices, alliums such as garlic, onions, they contain allicin, a potent plant compound that protects the body from brain damage and disease. They tend to be high in carbs. Use them in moderation. Dark chocolate, loaded with antioxidants and flavonoids that can decrease blood pressure and insulin resistance. Berries. Blueberries help in memory and brain functions. Raspberries and blackberries are rich in antioxidants, however, use them in moderation. They contain carbs. Avoid sugary foods, soda, smoothies, cake, ice cream, fruits that include whole fruit and fruit juice. Grains or starches including wheat-based products, rice, pasta, beans or legumes, peas, lentils or chickpeas, root vegetables and tubers, for example Irish potatoes, sweet potatoes, carrots and parsnips. Products labeled with a low-fat diet and healthy fat. Avoid alcohol. Perfect beverages are water, coffee and tea. Small amounts of cream to your coffee and tea won't harm. Taking small amounts of wine won't harm your diet either. What are some of the benefits one can enjoy from a ketogenic diet or keto diet? Burning of fat. Accumulation of or accumulating too much fatty tissue in your body isn't healthy at all and might predispose you to many serious conditions like heart conditions, atherosclerosis, stroke, obesity, which is a risk factor to diabetes, especially diabetes type 2. Fat is the body's normal fuel source, and it will generally be the preferred alternative where there isn't enough glucose to supply the brain and other body tissues with energy. Once certain levels of carb restriction has been achieved or reached, your body will become keto adapted, burning fat for energy rather than carbohydrates. By burning fats, you reduce the amount of fats in your body, and this may help fend off some of the diseases or some of serious diseases, both in men and women. Ketosis can be defined as having blood ketone levels of beta hydroxybutyrate between 0.5 and 3.0 millimoles per liter, which indicates that lipolysis is going on, which is a fat burning process, and the liver glycogen stores are depleted. The goal of a well-formulated ketogenic diet is to maintain this state of ketosis. Note that there's a difference between ketosis and ketoacidosis, a complication of diabetes that occurs when there are extremely high levels of blood sugar, insulin levels are very low, and fat burning has stopped almost entirely. Ketoacidosis can occur with prolonged fasting or starvation, but it's usually associated with diabetes. Weight loss.
I'm way skinnier than last time. I'm way healthier than last time.
The most common reason why most people resort to this form of diet is to lose weight. Low carbohydrates tend to be more effective at promoting fat loss. Increased lipolysis or fat burning effect is more likely the cause of this. Also, as well as a reduced hunger from high ketone levels. Once a person has adopted to a ketogenic lifestyle, either through dietary changes or fasting, this can promote significant weight loss without counting calories or controlling portions. Ketosis can be beneficial for many different disease states in the body, reducing the amount of medication required in some situations. Ketogenic diet can also be used for therapeutic purpose. Therapeutic keto diet, which is used for epileptic patients who don't respond to epileptic medication. Keto diet has been known to control epileptic seizures, not responsive to medications, especially in children with epilepsy. This has nothing to do with weight loss, but it's one of the reasons the diet is indicated. Ketone diet may also improve or slow down symptoms and progression of Alzheimer's disease. Has been shown in trials with mice. Human studies are needed. Ketosis may be an efficient or effective way to prevent neurodegeneration and damage from brain trauma. Also, this has been shown in animal studies. More studies are needed in humans. Controlled blood sugar may help control or reduce the risk of metabolic disease like type 2 diabetes and obesity over time by promoting changes in metabolism, improves drug utilization, immune surveillance, and so on. Can also help can benefit athletic endeavors by allowing quick access of energy through ketone burning, more effectively overcoming the acute oxygen deficit associated with exercise. A well-formulated ketogenic diet should not affect your ability to exercise, but it may reduce the amount of time needed for your body to recover post-workouts. This means that you can do more exercise without experiencing muscle loss or feeling overly fatigued. If you feel lightheaded or have impaired cognition due to hypoglycemia, consider adding exogenous ketones to your diet. Exogenous ketones can be taken in form of a drink, that's ketone salts, or in supplement form. For example, medium chain triglycerides oil or beta hydroxybutyrate salts, and they help raise blood ketone levels while providing a source of energy. For those who don't want to follow a strict ketogenic diet, this is often helpful in transitioning into a ketogenic lifestyle and still want to incorporate carbohydrate to support exercise, performance, and high-intensity training. Or if you feel fatigued on keto diet, ketosis might also provide protection or protective benefits against some types of cancer based on animal studies. More studies in humans are needed to evaluate this claim. Dietary ketosis can potentially benefit arthritis, polycystic ovarian syndrome patients, migraines, and other conditions with underlying inflammation. It is also said that it helps in mental focus and stabilize blood pressure. Keto diet also has its shortcomings, and it's not a type of diet I will recommend to anyone unless it's necessary, like in treating epilepsy in patients who are not responding to epilepsy medication. When it comes to losing weight, I will always recommend a good exercise program and proper dieting. A good exercise program and proper dieting will help you lose weight healthily without having to face unnecessary complications like in keto, or like people who are on keto have to experience. In fact, keto is only good for short-term weight loss, but not good for long-term weight loss. By diet, I mean considering a good healthy diet that will not make you accumulate a lot of weight and make your exercise program null, or sticking to a diet like keto that will deprive your body of important nutrients that your body needs in order to function properly. If you want to know that exercise goes in hand with dieting, take for example people who play long tennis. They normally use the dominant hand most of the times. So there's no point that you'll find that the dominant hand is always huge or is too large compared to the hand that is less used. This shows that for weight loss to occur, do your exercise and watch your diet. Because people are lazy to work out, they resort to non-ambulatory forms of losing weight. If for instance someone could come up with an exercise pill, for sure that person will become an instant billionaire. Anyway, back to keto. Ketogenic diet may lead to nutritional deficiencies. You will be depriving your cells of their essential nutrients that they need to function well, and may lead to increased in LDL cholesterol, which is the bad cholesterol, kidney stones. Keto dietary foods may make your body make more uric acid, and this may lead to formation of uric acid stones. And also increased LDL cholesterol may affect where fat is absorbed. The fat then binds to calcium and leaves oxalate behind. The oxalate is then absorbed and taken to the kidneys, where it can form stones. The diet is very difficult to adhere to, and it may also be associated with bone issues. Also, patients with renal issues have an increased risk of requiring dialysis due to additional ketones the renal system has to process. Food obsession. When you micromanage your food intake by tracking how much you eat, it disconnects you from what your body is asking. Monitoring food so closely can lead to psychological distress, such as shame and binge eating. Restriction can lead to binging, which often leads back to restriction in a continuous cycle. Following keto diet can make you feel pretty backed up. Keto can cause other body processes to slow down, particularly digestion. This occurs because people who follow the diet rarely get enough dietary fiber, which carbs are the primary sources. Fiber is essential because it helps in bowel movements, and you can get your fiber from eating foods like whole grains, beans, and fruits, which are cut off from ketone diet or ketogenic diet. On top of that, remember you are eating fats, or you are eating lots of fats, which can cause you to feel even more constipated. Ketosis may also give you halitosis. You may notice unusual stench coming from your mouth. When your body starts to break down fat for energy, gases called ketones, which include acetoacetic acid, acetone, and beta-hydroxybutyrate acid. These byproducts have a tendency of showing in your breath. Some people report of their breath smelling distinctly like nail polish removers. Acetone is an ingredient found in beauty products. On the brighter side though, this stench can signal that your keto diet is effective. It's a sign that the body has achieved fat burning. Drinking water and oral hygiene can help in this. Ketone can also increase your thirst. Make sure you have plenty of water at hand. Ketosis lowers your alcohol tolerance. It may be best to cut back on the drinks. It is possible for the weight you lose during keto to come back rapidly. Once you stop the diet, a lot of people may lose weight in the short term, but as soon as they reintroduce carbohydrates and get back to a normal way of eating, the weight comes right back. You may not lose weight despite your efforts. As said earlier, it may not work for everyone. Not recommended for diabetes type 1 patients, pregnant and breastfeeding women. In my conclusion, if you think this diet plan might be right for you and your lifestyle, I encourage you to consult your doctor before making any changes in order to make sure it's safe for you.